Today I'm here with Lynne Hibbard, who's a physical therapist, works in private practice and outpatient setting of performance physical therapy. Lynne, tell us about how your role as a physical therapist has evolved through the COVID pandemic.
So it's evolved quite a bit, as I'm sure it has for everyone who's practicing in physical therapy and every other health profession at this moment. Some of the biggest changes are obviously that I'm working from home. I know some people still go into the clinic for their telehealth appointments. I've decided to stay home for my appointments, and I'm now working out of my laundry room, which was an unexpected change. Most of the time in my slippers, which is much more comfortable than the dance goes that I would wear in the clinic. So I'm not super upset about that. But it's definitely eye-opening to see, where we were 2 months ago and where I am practicing as a clinician now. I've found that I am having to use more household items for a lot of my exercises and my patient education, which is both fun and very applicable, obviously, but also very challenging at the same time, like, using laundry detergent as a cone and soup cans for dumbbells and teaching patients how to do instrument assisted work with the handle of a large spoon. So it's been quite different and challenging, but also very enjoyable. My patients really seem to hone into the fact that everything that we're doing now is everything that they can and should be doing at home. Whereas when we were in the clinic, we were doing a lot of exercises that required different equipment, and as great as that was for challenging their muscles, it wasn't something that they could always do at home. And so it was hard to get the buy-in in the clinic in terms of doing someone's home program when their initial thought is, well, I can't do these things, so I'm not even going to try. Now they don't even have an excuse because I ask them what they have available, and we make it work. I had one patient who didn't have anything that was around 8 to 10 pounds to lift overhead, like an overhead press and a carry. And so I had him take a bunch of soup cans, put them into a bag, and together we were walking around his house holding the soup cans above his head. And it worked really well. And now that's something that he can do at home. And he's, he has to advocate for his own care and really take control of his recovery at this point because he can't come into the clinic twice a week. So, that's how things have really changed in terms of how I treat and what my day-to-day looks like. It's also been quite bombarded with my dogs. I am a stay-at-home dog mom now, which is very interesting. Much different than having a baby, but still challenging when you have two 1-year-old puppies that are each about 80 pounds. And honestly, I think it's made my days even better because my patients love seeing my dogs. I love playing with my dogs. They tend to lie down right next to me while I'm doing my core strengthening for my patients. So everyone gets a good kick out of it. I always make sure they know that dogs are not required for their exercises, but it is a bonus. So those have been like the most changes. And, I would say that the biggest challenges that I'm facing is, as a new professional especially, and a pelvic floor therapist who is very in tune with manual therapy, and it's been a huge piece of the way that I treat for my patients, losing that is quite difficult. It's definitely been very challenging because, there are some days that patient describes this feeling that they have in their lower back pelvic area, and I just want to get them into the clinic so I can get my hands on them, and I obviously can't. That's not an option at the moment. So trying to find ways of helping the patient learn different movements and stretches to, as best as we can, get them to get that similar effect of the manual therapy without actually getting it, has definitely been probably one of the biggest challenges for me personally. And then, the the basic challenges of the telecommunication. Some people don't have access to these virtual meetings, and we have to do it just over the telephone where I can't physically see that person, and that's very challenging. And it's, I can't see even through the virtual meetings, those really minute details that I would usually correct in the clinic and I can't see now. So, I've learned to be much more descriptive with what the exercise should look and feel like, and really, really, really teaching my patients to be in tune with how their body feels during these exercises so that they are getting out of it what they should be getting. So it really puts the ball in their court in terms of this is what I want you to feel. And then them having to really be in tune with themselves to see, am I feeling the right things? And that, just goes back to, in terms of using all of these new equipment at home and the soup cans and the laundry detergent and everything, and putting the ball back into their court, we're also able to bring them back to their goals and their activities of daily living, which I think we lose sight of a lot in the clinic. I mean, we put it in our notes, patient can't bend down, patient can't carry the laundry basket, but it just becomes a goal that sits at the bottom of our documentation. And I think now, because we're seeing our patients in their home, I can really use all of those ADLs as part of their program. Carry your laundry basket up and down the stairs 5 times. Let me watch you carry your laundry basket. Let me see you get in and out of bed. Getting it on and off a plinth is much different than getting on and off a soft mattress that's 2.5 feet off the ground. And that's really helped with getting the patient buy-in on the telehealth as well, because they're just as confused as we are. This is a big change for everyone on every level. So, being able to tie it back to what they really want it's been very rewarding for me and my patient. And I've noticed that they've been so much more compliant with doing all of their exercises and whatnot, because they could see how applicable it is to them now.
Wow, lots of great information there, Lynne. What are you looking forward to for the future?
I am very excited to see how we can continue to use this for patients who maybe don't have the transportation to get into the clinic. So now we can still provide them that care and do these virtual meetings from their home. And they don't have to be concerned, well, I have to schedule the bus or I have to schedule my friend to come. And, I think that's been a really big barrier, especially, depending on where you work. If you work in a big city like how, we work in Providence, and we get people of all different backgrounds and socioeconomic status, and quite a few of them take public transportation. And that's been very difficult from time to time for them to get into the clinic. So having this as an option is going to be, very important, because, let's say 1 week they can't come in. I still feel good knowing that I can set up a meeting with them to still make sure that they're getting the care that they need. I also love the thought that, kind of going back to what I said about really applying it to their goals and their activities of daily living. Maybe they come in once a week to the clinic, and then maybe we do once a week of a virtual meeting where I can see them doing the things at home that they are telling me in the clinic are really difficult for them. And that's a lot easier to replicate in their own environment than it is to replicate in the clinic setting.
Awesome. Well, it sounds like these challenging times bring an opportunity to learn new skills and help us ultimately evolve our practice of physical therapy. Any final words of wisdom for any of your colleagues out there who are challenged or don't understand telehealth and want to understand more about it?
I would say, don't be hard on yourself in terms of trying to develop this incredible home program with all these different exercises and different equipment, utilizing whatever the patient has to really get them better physically. I think truly the most important thing, especially in the situation that we're in with COVID-19, is not getting our patients better physically. I think it's the emotional and the mental support that we're giving our patients through these appointments that will ultimately make them feel better. You know, we know from research what stress and feelings of isolation do to the body and the inflammatory processes, and how that can affect someone's physical state. So, you know, if we take a step back out of our clinic shoes in terms of, you know, I need to be doing A, B, and C exercises, and more into just understanding that person as a person and giving them that emotional support that they need, and that, you know, being able to discuss with them how things are going to be okay, even though you don't have all the answers. I think that is the biggest thing that we need to focus on as clinicians right now versus that physical piece.
All right, thank you, Lynn. Keep up the great work.
Thank you, Michelle.